low back, it's feeling tight today. Can you relate? Do you ever have that low back discomfort? Do you live with it on the regular? Or maybe you just had a long plane flight, a car ride, a long day at the office, sitting in your desk chair. When people come to me and complain about low back issues, the first thing that I have them work on is just regaining as full of movement as they can through mainly their hips. Because when the hips are locked up, what ends up happening is we compensate through the tissues that are either above the chain or below the chain. So some of us have never actually gone through these full movements through the hips. So it can be beneficial not only from a pain mitigation standpoint, but it can also be a nice drill to start to use as part of our movement vocabulary. What do I mean by that? I mean, when we have to know all of our body and how to control each one individually so that we can put them together for larger, more complex movements, whether it's training, sport, high skill activity, or just being a parent or living your everyday life. So what are we going to do to start to alleviate and start to bring relief into that low back? We're going to start with some pelvic tilting. Now we've got different planes of motion that the pelvis can move in. So we're going to use a little visual aid here to serve as our pelvic bowl. Now in a perfect world, we would all want to be standing with a relatively neutral hip. We can imagine this like our bowl. It's going to mirror our hips here. If we tilt that bowl forward into an anterior tilt, we sort of see this action here. Now some of you might even feel more pinching or more discomfort when we get into this. Others of you might feel that when we get back to neutral or beyond into what we call that posterior tilt, right? This bowl is spilling backwards, all right? So in trying that, you might notice, wow, I can't even do that action. And that's okay. Sometimes if we haven't been in that position in a long time, we've lost that connection with the brain's ability to control those sections of the body. But fear not, with practice, we can regain some of that control. So we're going to start with just a couple of drills to get us on board with our anterior and posterior tilt. Take your thumb and your first finger, and we're going to grab around our pelvic rim. So you can see here, I'm just along my waistband here. I'm going to soften just a little bit in the knees and use the fingers like a driver to tip the hips forward and tip the hips backwards, right? And as you go through this and all of these hip drills, our number one priority is to move at the highest quality. That means slow, that means smooth. If there's any movement that's quick or we're trying to rush through it, that's probably an indicator that we need to spend some more attention and more time there. If the movement is ratchety, it doesn't come naturally, totally fine. Slow it down even more until that movement becomes more smooth. Now, if you haven't been in these positions in weeks, months, or even years, it may take us a number of sessions, a number of times doing this to find some freedom in this action. Okay. When you get a little bit more comfortable with this position, we can stop using the hands as drivers and see if we have that control through the body to go through our anterior tilt and posterior tilt. Or like a tailbone tuck in yoga, you hear that action. Anterior and posterior. All right? So what you can do in your own is to try to practice these for 1 minute to 5 minutes each day so that you can start to build up your familiarity with these shapes and these sensations through the body. So the next plane of motion that we can move through in the hips is a lateral tilt. So again, we're going to use our visual aid, and we're trying to get this action out of the hips here, okay? This one's a little bit more tricky than the anterior posterior tilt. It takes a little more work through the obliques. So if we're having trouble doing this standing in the middle of the room, try to bring yourself up to a wall. All right? We're going to sit back onto the wall, walk the feet forward about 12 inches or so, and we're going to soften into the knees. Now I can imagine that through my sacrum, I've got a stake, so that I can't, it's like a pinwheel. I can't slide, but I can rotate. All right, so that's the action here. We can imagine that that's glued into place, and again, using the thumb and the first finger to be our drivers here, we can try to lift up through that right hip, kind of press down on the left. Right, bring it back to neutral. Other side, so I'm lifting up through the left, pressing down through the right. Right, back to neutral. Good. Right, and I'm using the wall here for a little bit of aid. And again, when you get familiar with this shape, and I'm noticing here to hike up, a lot of work through the obliques and the side body. Pull that hip up. Let's send that down, other side. Good. When you're starting to get it, we use less of the hands to feel that action. See if you're able to control that again. High quality is our priority, so slow and smooth. Okay. So far, so good. When you've got that mastered, we can come away from the wall and work that action. Softening into the knees, hip, and hip. All right? I'm also getting you ready to hula, so double lesson here. Good. All right. So we've got two planes of action. We've got our anterior tilt, posterior tilt. We've got our right hip hike and our left hip hike. Now what does this look like when we add these pieces together? We start to get a gyrating action. Let's use the visual aid to see what's actually happening here. So anterior tilt, posterior, right hip hike, left hip hike. If we put them together, we start to get this gyrating action, right? If you dropped a coin on the floor, you would kind of see that happen naturally. We're going to do the same thing through our hips. So we'll start by anteriorly tilting. We start to bring it around or bring that right hip up. Posterior tuck. Another side. All right, so I'm just using this ring so you can kind of see what's happening here. This one is definitely the most advanced of the three because it takes not only a lot of concentration, but the coordination involved to do all of these actions at the same time can be a little tricky. And here's the kicker. Once you've gotten really good there, we've got to reverse the direction. And if you're anything like me, this second direction feels like I'm in a different body, to be honest. It doesn't come as naturally to me. I feel kind of ratchety as I kind of come around this corner here. So what I would do, in my case, is that I would slow it down even more and just kind of floss through this portion of the entire circle, if that makes sense. So I'm just going to kind of floss through there because I feel this action is a little ratchety. I can't get it smooth yet. So I'm just going to slow things down until that feels a little bit more normal to me, right? And already the kind of pinching tightness sensation that I was feeling in this part of my back as I went through that range, as I slowed it down and stayed in that area, is already starting to calm down a little bit. So if you're having any trouble with any of these levels, be patient with yourself. This doesn't come easily, especially if you haven't done it in days, weeks, months, or even years for some of us. So be kind to yourself and just enjoy the process of learning your body. This can be a really helpful tool after a day of sitting in meetings. Maybe you had a long trip. This is really good to do when you get off the plane. If you're a weirdo mover like me, you might do it standing in line at the grocery store. I get a lot of odd looks, some phone numbers. I'm just kidding, I don't get phone numbers, but right, these movements can also look a little weird, right? So if you're somebody who's a little bit more self-conscious about this stuff, maybe practicing in the comfort of your own home in front of a mirror so you can see what's going on can be a really helpful tool. Perhaps you videotape yourself so you can see what's happening here. But if you're blazing that trail, you can go right into your local gym and just start staring them in the eye and going through your hip gyrations. However you want to incorporate it, it can be a nice active rest between squat sets just to make sure that we're not getting too compressed through the lumbar. It can be a great tool to apply anywhere through your daily movement practice as a warm-up in between your workout sets. And it can be just a great tool to keep you feeling mobile through your hips and relief out of that low back. If you have any questions for me, please feel free to ask. And I hope that helps bring you some freedom around your hips and around your spine. Thanks a lot.